Andrew has a video question about the keto diet. Let's take a look.
Hi, doctor. Functional medicine doctors have said that the keto diet can reverse, reduce, even stop a lot of the symptoms of Alzheimer's. And what I'm wondering is that in fact true? Are there any studies that suggest that the keto diet can have this lasting impact?
Great question from Andrew, doctor.
Yeah, thanks, Andrew. So there's been a lot of interest in the ketogenic diet for lots of different neurological conditions. Some people might be most familiar with it as a treatment option for certain forms of epilepsy, especially in children. But it's thought to have possibly some benefit in certain neurodegenerative conditions. So far, there haven't been any large-scale clinical trials looking at these sorts of diets to show a clear kind of benefit. However, there have been mouse studies as well as some other animal models that suggest there could be some benefit from a ketogenic diet. There have also been some case reports that suggest there could be some benefit. But as it stands right now, I would say there's not enough evidence to clearly recommend it to patients at this point.
And doctor, for some of us that don't know what the keto diet really entails, can you talk about that and maybe some foods that you yourself recommend that some patients actually eat or maybe stay away from?
Yeah, so there has definitely been a fair amount of research when it comes to diets in general. And a ketogenic diet is a diet that is designed to generate something called ketones in our bodies. So our normal primary energy source is glucose. That's what the cells of our brain like to use. But in certain states, especially if we're consuming low amounts of carbohydrates, our body starts generating ketones actually from fat. And these ketones can be used as an alternative energy source. Now, when it comes to some of the other diets that have been looked at, what has been found is that a Mediterranean style diet actually seems to be one associated with a lower risk of cognitive decline over time. And so for those not familiar, a Mediterranean style diet is one that is higher in healthy fats, so like what you might find in fish, nuts, olive oil, and also has plenty of vegetables, especially leafy green vegetables, and then emphasizes more whole grains rather than refined sugars. There have also been some diets that have been developed, or that are being developed, I should say, that combine elements of the Mediterranean diet and others. So there's something called the MIND diet, which stands for the Mediterranean Intervention for Neurodegenerative Delay. And the DASH diet is a diet that stands for Dietary Approaches to Stop Hypertension. So there's plenty of evidence to show that high blood pressure, hypertension, especially even earlier in life, can be associated with a higher risk of developing neurodegenerative disease like Alzheimer's disease as people get older. And so controlling that from an earlier age may have some benefit. So the thinking is that if you can combine these sorts of things, you may have even added benefit. And there are ongoing research studies to try to find if this is in fact true.
And doctor, real quick, what about sugar? Sometimes we hear that it can make patients worse, even with cancer. And obviously we're talking about Alzheimer's. What's your thoughts with sugar?
Yeah, so I've generally been one not particularly advocating for super restrictive diets, completely cutting out any particular nutrients. And there's been some research that suggests that high carbohydrate intake can be associated with difficulties in multiple different organ systems, but the nervous system too. And I think the thing to probably keep in mind is that moderation is key. I don't think that there's significant evidence to show that sugar in and of itself is a particularly detrimental thing for the brain. But just as with most things, large quantities of them are certainly not going to be good.
All right, thank you, doctor. We have a question from Dean. So let's take that question and see what he wants to know. What are the 3 things people can do to slow the progression of Alzheimer's disease? Great question, Dean. Doctor, your thoughts, please?
Yeah, so thanks, Dean. There have been some large-scale trials, both done in Europe and currently ongoing in the US, to look at different sorts of lifestyle interventions that might be helpful to slow the progression of Alzheimer's disease in individuals who are already showing symptoms of it. So one of these interventions we kind of just talked about, and that's diet changes. So instituting a Mediterranean-style diet or this MIND diet seems to be one thing that can help. Another probably bigger thing is actually physical exercise. So we know that people who get a lot of regular physical exercise on a regular basis do significantly better over time, potentially almost as well as the benefit that can be gained by certain drugs that are already out there. So the more physically active we stay, it seems like the better off we are in the long run in terms of disease progression. And then a third thing that I would mention is doing things that keep our minds stimulated and active. So not that there's anything inherently wrong with watching television, but doing things a bit more active, less one way in nature is a good strategy. So definitely anything creative like music, art, those sorts of things, but even just reading, doing puzzles, playing games, especially games that you might engage with other people doing, those are great things as well.
I remember when my girls would visit a center near our home with some elderly people with Alzheimer's, they would dance and sing, and it was just amazing to see how they would be very still, and within a few minutes they would start partaking with the girls, and it was very magical, to be honest, doctor, to see something like that.
Oh yeah, and just the social component of these sorts of things play a huge role too. I mean, I just know that in my own patients who I've been seeing over the past year, unfortunately, the pandemic has taken a particular toll on many of them, largely because of just the increased isolation that a lot of people experience, and people who may have dementia and benefit from having more contact with others really seem to have a little bit more decline over the past year or so. And there have been some studies that have shown this to be the case. And it was just a very difficult situation because we also know that this was a population that was very susceptible to complications from the virus itself. But then a lot of the precautions that were necessary also had detrimental effects. So fortunately, now that things are starting to get a little bit better in that regard, a lot of this social side of things has started to come back, and people have started to show some benefit from that again.
Amen to that. Okay, doctor, I have a question. Actually, I have a few questions from Steve. He's packed a few in, so let's get to all of them. How important is getting enough sleep in preventing Alzheimer's disease? How much sleep is enough? And do Alzheimer's patients tend to sleep a lot during the day? So lots to talk about here, doctor.
Yeah, so it's a very good question, Steve. So to answer the first part, with respect to the importance of sleep in terms of preventing or delaying Alzheimer's disease, there was actually a study within the past year that was published that found the importance of sleep even from a younger age. So people who earlier in life had a history of inadequate sleep, insomnia, just not sleeping enough, they were at definitely a higher risk of developing Alzheimer's disease as they got older. And part of this is thought to be that sleep is very important for sort of the housekeeping of the cells in the brain, because degenerative diseases like Alzheimer's disease are caused by accumulations of abnormal things, and sleep is something that may help prevent this accumulation from happening sooner rather than later. Now, the question as far as what's enough, that's going to vary somewhat from person to person, but a general good rule of thumb is that most people on average need somewhere between 8 to 9 hours of good restful sleep at night. And some people get by on less, some people think they get by better on less, but for the most part, 8 to 9 hours is usually a good amount to shoot for.